Hi, I'm Justin Riley. Today on Wisconsin Doctors, Orthopedics. We are on location at Upland Hills Health here in Dodgeville to find out when exactly is it time for you to get that surgery that you might have been putting off. We'll find out a little bit more about the procedures themselves and the process, as well as patient concerns. We'll address some of those, and we'll find out about the outcomes and how to prepare for your surgery if that is the right option for you. My guests will include Dr. James Self, orthopedic surgeon here at Upland Hills Health, and Melissa Messer, physician's assistant. It's all coming up right here on Wisconsin Doctors. Stick around. Welcome back to Wisconsin Doctors. We are on location at Upland Hills Health here in Dodgeville, and today we're discussing orthopedics, and I'm joined now by two members of the orthopedics team, Dr. James Self and Melissa Messer, physician's assistant. How are you guys?
Good, how are you?
Well, thank you for having us.
Good to have you back on Wisconsin Doctors. It's been a while since you guys have been on. I think we were discussing before the show that I think it was maybe our second episode altogether that you guys were a part of, so it's great to see you guys back.
Thank you.
Thank you.
Yeah. So, Dr. Self, I'm going to start with you. Describe your background. What led you to want to specialize in orthopedics?
Well, I originally went to college for mechanical engineering. I have a bachelor's degree and master's degree in mechanical engineering. And while I was doing my master's work, I was working with a professor that was interested in artificial muscle and doing some work on that. So I actually worked as an engineer for about 6 years, but during that time looked into doing something different. So I went back to medical school at the University of Texas Medical Branch. And I did my medical school and my residency there. And then I did an orthopedic fellowship at the Mayo Clinic in Rochester, Minnesota. And I've practiced in Wisconsin since then, in La Crosse and Madison, and then I moved out here to Dodgeville in 2010.
It's amazing how, somebody may start their schooling or their education thinking they want to do one thing, and then life takes them in a completely different direction.
Yes, and when I went to medical school, I was wanting to go into orthopedics because there's a lot of overlap between engineering and orthopedics, and luckily it worked out.
Yeah, good for you, good for you. So what issues fall under the umbrella of orthopedics? And I mean, in other words, what are the physical problems that you are helping people to alleviate?
We practice what we call general orthopedics, which essentially involves the upper and lower extremities. We treat various types of fractures. There are a lot of what are called soft tissue injuries, muscle, tendons, cartilage, ligaments, things like that. We also treat arthritis of the various joints. There's a lot of non-operative and operative treatments. We do things like shoulder replacements, hip replacements, knee replacements. So it's a lot of different things, but pretty much localized to the upper and lower extremities.
And Melissa, I'm going to turn to you for a second here. How did you get into orthopedics? What led you to this interview here today?
Well, I've always had an interest in science, biology. I originally got my biology degree at University of Wisconsin-Platteville. After that, I did research actually at the University of Wisconsin-Madison Veterinary School, which I enjoyed working in a lab, but I realized I needed to work with people. That's when I looked further into physician assistant school, and I did that in near Chicago, Illinois, and I got my master's degree. Originally out of school, though, I did urology, which is another type of surgery. But as our family was growing, I grew up in this part of Wisconsin. I wanted to be closer to family. Sure. When this opportunity came up to continue to do a surgery in a small town, I jumped at it and have loved it ever since.
That's fantastic that you guys are able to offer such specialized care and surgery in such a small area. I mean, people don't have to travel an hour now to get the surgery and the care that they need, which is great. How long have the two of you been working as a team? You guys are a team effort here. How long have you been working together?
December 2010 is when I joined him. So late 2010, we've been working together.
Okay, great. And Dr. Self, I'm going to come back to you. How many procedures do you think that you two have performed together since you've been here?
Probably since we've been here in Dodgeville, about 1,000 procedures.
Wow. 1,000 procedures, and you've only been here a couple years.
Well, we've been here since 2010, so.
Okay, but you've been here since 2010. So wow, that's 1,000 surgeries. That's a lot of surgeries. So thank you for the information. We're going to take a short break here, but when we come back, we're going to talk about patient concerns right here on Wisconsin Doctors here at Upland Hills Health. Stick with us. Hey folks, welcome back to Wisconsin Doctors. We are on location at Upland Hills Health, and today we're talking orthopedics with Dr. James Self and Melissa Messer. And Dr. Self, I want to just jump to you for a second here because obviously we're going to address some patients' concerns. What condition are patients typically in when they make it to your office?
Well, we see a variety of patients, actually from young children to the very elderly. Depending on the age, what we see them for usually changes a little bit. With kids, it's frequently fractures or soft tissue injuries. As people get older, they tend to start having problems with joints that are wearing out and arthritis and things like that. And in between, it can be a combination of soft tissue injuries or fractures or what have you.
Yeah, and I can only imagine that having a joint replaced, I mean, because that's obviously what you do is joint replacement.
One of the things we do, yes.
So having a joint replaced is not something that people take lightly, I would assume. So is surgery the only solution? You talked about how you do some other things as well. What are some of the other solutions that people can go for?
There's quite a few different options, non-surgical, for treatment of arthritis, and we always encourage people to put off a major surgery like that until it's necessary. But it's frequently a patient decision, but there's lots of things to try, including physical therapy, medication, injections, braces or splints, activity changes, and a lot of different things that can be tried to buy people time until they really have to do that joint replacement.
So the joint replacement really is sort of a last resort for people. We don't want that to be the go-to.
Right.
We want to have them try to fix it on their own through physical therapy or whatever else they can as much as possible.
Right, it is a last resort, but when they get to the point that they really can't enjoy a quality of life that they want to, that's when we start looking at that. But yeah, there are many other options. Once they get to that point, many are very happy that is their, a final option that gets them back to being active again.
Yeah, because they want to have that quality of life for sure.
Right.
Melissa, I'm going to turn to you for a second. What are the biggest concerns your patients have? What questions do they have when they come in to your office?
Sure. Well, as you said, the joint replacement is quite a large surgery, and so it's a big decision to be made. A lot of times they'll bring their family members, their spouses. Most times I'll be the one answering a lot of those questions. So one of the big ones is this going to hurt? People say, that's a big surgery, this is really going to hurt, isn't it? Our staff here, our anesthesia providers, do a wonderful job keeping people comfortable. We're trying to find different ways of keeping people comfortable without being on narcotic pain medicine. There's a very big problem with pain pills nowadays. So we're doing lots of things to treat pain in several different ways. But any large surgery does have some pain involved with it.
Of course, yeah.
Other things they ask about, when will I get back to my activities? They're wondering if they're going to be in the hospital for a long period of time. With a knee replacement, they're actually walking on it the very next day. Hip replacements,
to me.
There is some aspect of walking on it the very next day. It just depends on how much weight we allow them to put on it. So getting a joint replaced is not something you get and sit back and relax on. It's actually a lot of hard work. Us doing the replacement's the easy part. The next part is the therapy, getting stronger and getting back to using it. So there's a lot of work in the first 6 to 8 weeks of getting their strength back and making sure they have the range of motion.
And as I understand it, there's a lot of preparing on that end as well. They do some physical therapy prior to the surgery so that they can be ready so that the recovery process afterwards is not quite as long. Is that correct?
Correct. The stronger your muscles are going into the surgery, the better your recovery can be. It'll also teach you how to do the exercises so that you can do them properly once you're home.
Right.
There's a combination of working hard on your own at home and then also coming in and working with a physical therapist. So the better shape a person can be in prior to surgery, the more positive outcome. That also includes cardiovascular health, making sure they have a strong heart and that they can handle anesthesia well. So the better overall health, the better the outcome.
Of course. We got to take a short break again here, but when we come back, we're going to talk a little bit about the improvements that have been made in the procedures of orthopedic surgery. Don't go away. There's more Wisconsin Doctors coming up right after this here at Upland Hills Health. And welcome back to Wisconsin Doctors. We are here on location at Upland Hills Health in Dodgeville, and today we're discussing orthopedics. And we're talking with Dr. James Self and Melissa Messer. And Dr. Self, I want to ask you about procedures. There have been a lot of improvements that have been made to these orthopedic procedures over the course of however many years they've been doing them. What improvements have you seen since you've started doing these procedures?
Well, hip and knee replacements are the ones that have been around the longest, and they've probably seen the most changes over the years. There's always something new in hip and knee replacements, whether it be how they're fixed or attached to the bone or the different types of bearing surfaces, whether it's plastic or metal or ceramic. So there's always new things coming out, but one thing we have learned over the years is that until you've seen some clinical results for several years, you never know which ones are going to be good and which ones are going to be not so good, and there have definitely been some that have had trouble. So we try to pick joint replacements that have a proven track record. Although they may have been improved over the years, we know that they have a good track record. But there's a lot of different changes that come along all the time, whether it be with just the surgery or the rehab or medications we use before and after surgery. So we're always looking at new things, but we're also cautious about jumping into something too quickly.
Yeah, jumping into something that hasn't been established necessarily. Yeah. So folks who are listening to this right now who maybe know somebody who could be a candidate for orthopedic surgery might be listening to this and say, okay, that's great, but bottom line, how does this affect me? How does this affect the patient? Can you talk to how this affects the patient, these new developments?
Well, there's some of the newer joints that have been tested thoroughly in the lab for many, many years, and we think they're going to last longer. We don't know for sure yet, but they have in the lab. So we've been trying to use some of the materials with better bearing surfaces, better longevity. We've also been looking at some new ways of doing things where we've always had all different sizes of joint replacements when we do that, but so they're not totally custom to the patient, but the cutting blocks or the tools we use can be custom to the patient. And so more recently we've been looking at doing some special tests beforehand to get some specialized tools that we use during the surgery to make it more of a custom procedure for that particular patient.
I think that's comforting to know when a patient hears that the surgery is going to be customized to them. This is not just a one-size-fits-all. I've done it the exact same way of 1,000 other people, so you're 1,000 number one. It's really customized to them, which I think is great, because each person has different needs.
Right, yeah. And so we do try to customize things we can, but as the joints themselves, they've been around for a long time, tested, and we always have multiple different sizes because everybody is different size. Everybody's
a different size. Melissa, I'm going to turn to you for just a second here. Obviously, this is not the entire orthopedics team here. There's several other folks who are involved. Talk to us a little bit about some of the folks that make up the orthopedic team here. Who are they and how are they involved?
Okay, well, it's Dr. Self and I, but we also have a great department of nurse, a secretary, athletic trainers, and that's our immediate group. But beyond that, we also have the rest of the hospital. X-ray or radiology helps us. We can't get to these decisions without X-rays. Physical therapy is crucial. You can't have a surgery without having therapy afterwards. And then just the hospital staff, having people to take care of you during your surgery and after your surgery. So honestly, all of Upland Hills Health is our team.
I think it's great to know that, the people who are involved, like an X-ray and so forth, are literally just a walk down the hall. I think that's incredible. Yep. So walk me through the whole process. When a person makes the decision or their physician helps them to make the decision that they've had enough, they want the surgery is their best option, they want to get better mobility or pain-free mobility, what are the steps?
Sure. So it starts with a new patient consult, and what that means is our appointment coordinator, Sharon, will call the patient to establish a time to come in. They need that first appointment. Typically, we'll update X-rays, so they'll have them taken again that day. They'll meet Donna, our nurse, who will check their medications, get them ready, get their vital signs. The next person they meet is an athletic trainer, and that would be Casey, Mike, or Donnie. What they're going to do is start to interview the patient, get their story, find out how long it's been going on, and then they're going to do a thorough examination. That then allows them to give the idea and the story to Dr. Self so that he can focus directly on the main problem. So he'll review their X-rays and their problem, tell them what the options are, and so that may lead to therapy or it may lead to surgery. Once they decide on surgery, then typically they'll come see me. We'll talk deeper about the surgery, the risks involved and what the recovery is like. From there then, there's typically a physical to get cleared for surgery and the day of surgery. From there on out, it's therapy and repeat visits in our department.
So when someone says, I think I might need surgery, it's not like, okay, we'll get you in tomorrow. I mean, there's a long
Correct.
process prior to that.
And then it's making sure people understand what they're getting into and making sure that they're healthy enough. The more education you can have going into it, the more comfortable you're going to be with the surgery.
Absolutely. We got to take a short break again here, but when we come back, we're going to talk about preparing for surgery and the outcomes of that surgery. Stick around. It's Wisconsin Doctors at Upland Hills Health. And welcome back to Wisconsin Doctors. We are here on location at Upland Hills Health in Dodgeville, and we've been talking about orthopedics with Dr. James Self and Melissa Messer. And now we're going to talk a little bit about preparing for your orthopedic surgery and the expected outcome. So, Dr. Self, I'm going to start with you. If a person is considering surgery, if they feel like that's their best option, Melissa talked a little bit about the consultation that kind of goes on prior to that, but what advice can you give people right now?
Well, I think, as Melissa mentioned earlier, being in the best physical condition possible before, especially before joint replacement, really plays a factor in the rehab after the surgery. So anything people can do to increase their physical fitness is always helpful. For people who smoke, there have been a lot of studies that have shown that smoking does increase some of the complication rates after any type of surgery. And so we always encourage people, if it's possible, to stop or at least cut down smoking before surgery. Another factor is weight. There's also been studies that show that people who are extremely heavy have some increased complication rates and not quite as good of results after surgery. But we know that with sore joints, it's hard to work and lose weight, but anything that they can do along that line significantly affects their recovery and their rehab as well. So it's getting into physical condition, and it's also a kind of a mindset of getting ready, knowing what you're getting into and being prepared for what comes after. And fortunately in this area, a lot of our patients know other patients that we've treated, and so they kind of have an idea of what's coming.
Absolutely. So this is a great way. I mean, all these things are to help make sure that the recovery is as speedy and as uncomplicated as possible, right?
Correct.
Yeah, absolutely. So, Melissa, I'm going to turn to you real quick here. Is there an advantage to having your surgery here at Upland Hills?
Sure. I think it's the one-on-one care you can get. The smaller hospital feels more personalized.
Sure.
Patients love it when they can wake up and see the same nurse that they saw the day before. They know how they were feeling the day before. A lot of times with physical therapy, they can see the same therapist throughout the weeks. Also, our facility utilizes some of the same specialists that larger cities have too. There is a group of people in the lab that is similar to what you'd find at a larger city. Our emergency medicine doctors are also from Madison. So we have a combination of local and distance, and to give us that full picture.
Sure, yeah, and you guys have some pretty cool stories about people who have made full recoveries and are able to do the things that they want to do. Can you recall some of those stories? Sure.
One that always sticks with me, is near and dear to my heart, is a patient who had very worn out knees. He had both knees replaced, and he would tell me stories of standing at football games, being in so much pain, having to ask someone to help him to go up the stairs. After his surgery, he was doing well, and I happened to be with my family at a Brewers game, and we ran into each other, and he was so proud to see me. We hugged, and he said, "Melissa, I parked far away, and I walked myself in. That's something I couldn't have done before this." So that one has always stuck with me.
That's awesome.
But we've had other couples who say they've gotten back to ballroom dancing.
That's great.
We have a young wrestler who went back to wrestling again, too. So surgery can help open up new doors, too.
That's awesome. That's awesome. And I think it's really cool that this patient felt close enough to you to come up and give you a hug and everything. I mean, that just kind of shows the level of personal attention that people really get here when they come in for surgery. So.
And that's what I like, too. I mean, we really have a chance to get to know our patients. These are the same patients I see at Walmart and at the grocery store. Right. So I don't know if you can get that in larger cities. So that's another benefit.
One of the other benefits that we have available here is that we have rehab facilities here right at the hospital. So In a smaller community, if you need to go to what's called swing bed for some additional rehab after surgery, you can stay right in the same room. Or we also have a rehab center attached to the hospital, so it can all be done in just one location. And a lot of people really appreciate that. I
think I would appreciate that if I was coming out of surgery, not to have to relocate myself the very next day. So that's great. Well, I appreciate you guys talking. Before we go, bottom line, is it worth it? Is it worth it to come here for orthopedic surgery?
I think we have many patients who tell us it is, and
Yeah.
I think overall people do well and are very satisfied with the procedure.
Absolutely.
Yeah.
Yeah. Well, thank you so much for joining us today. This is Dr. James Self and Melissa Messer, part of the orthopedics team here at Upland Hills Health. Thanks for joining us today on Wisconsin Doctors. From all of us here at Channel 57, we're inviting you to live longer, live better. We'll see you next time.